Hi, my name is June. I'm a physical therapist here at Beyond Basics. So what let me into this career in physical therapy began in undergrad. I was originally a pre-med major, got a job at a PT clinic my junior year of college, and I realized, oh wait, actually this is what I really want to do. I loved seeing the PT work with the patients and seeing them interact with the patients on a weekly basis. And to me, it just felt more fulfilling to get to build that rapport and get to know people on a more personal level. And that's when I decided to switch my career path and went down the PT route. Started off working in home care, mainly with the geriatric population, and I found that to be really rewarding. And I transitioned into a hospital outpatient where I worked a lot with patients post surgery. So I have a lot of experience with, post hip replacement, knee replacements, all that, a lot of pain management. And then eventually I thought, like, oh, I really want to work with patients one on one. I think that would be really rewarding. So then I switched to more private clinics that offer that kind of atmosphere. And then I decided that, yeah, you know what, I really want to go into pelvic health. And I switched over to pelvic health, and it's been really great. Throughout the course of my career, I eventually began to take on a more holistic approach to healthcare. And so I found myself asking my patients questions about, their lifestyle, their bowel function, their bladder function, sexual health, gynecological issues. And the common denominator I found is that a lot of these patients do have pelvic floor issues. And at the time, I wasn't equipped to fully treat pelvic floor, and I realized like just how important of a piece pelvic floor is in terms of treating my patients. I just decided that this is something I really want to delve into and to really provide the best holistic health I can. So with my treatment approach, I like to integrate Eastern and Western medicine with my pelvic floor training. I specialize in trigger point release and scar tissue. And so for me, I found it to be really helpful with my manual techniques, and my patients have found that to be really helpful. I would love to talk about your case in more detail, so please feel free to give us a call for a free 15-minute phone consultation here at Beyond Basics.